Yeah, I guess we'll just start off with having you like introduce yourself to the people that don't know who you are. Talk to us a little bit about you, your journey, what Strive Physical Therapy is.
Sure. So, yeah, my name is Travis. Obviously, I'm a physical therapist, and I'm also board certified in sports physical therapy. So I just took my SCS exam and passed that this year. So I started Strive about 3 years ago. I've been practicing PT for about 6 years now, but I started Strive 3 years ago. But as far as schooling, I did my undergrad and PT school all at Lebanon Valley College up in Pennsylvania. So it was a 3+3. So it was a kind of a little bit different experience than what you guys might be going through with kind of the 4+3. So it was a little bit different there. But after PT school, moved down the shore and took my first job kind of in a general outpatient ortho a national company kind of clinic, just general outpatient. I worked there a couple of years and then started Strive to really, focus on the rehab of athletes and high level athletes. Um, I was finding that working where I was working before, I was starting to work with these athletes, but I didn't have the resources, I didn't have the time, I didn't have the space to actually rehab them properly. So finally, kind of over the summer of 2020, things slowed down in the world. So um, took the leap, started Strive Sports Medicine, and then kind of history from there. So we work with all athletes, college students, and even active adults in the Salisbury Fruitland area. We have two locations here as well, one in Fruitland and then one in Salisbury up towards the mall. If people are familiar with that. So we partner with two sports performance gyms. So we're gym based in both of them. Competitive sports performance in Fruitland and then A4 training in Salisbury.
Cool, man. We love that.
Yeah, that's awesome. We can just piggyback off what you just said, and I know you mentioned it a little bit, but like, how do you feel like that being in that gym aspect kind of almost like makes PT feel like training instead of rehab? Could you talk a little bit about like the focus on that, and that's if that's kind of like what you guide your patients with and try to build that confidence back to return to sport?
Yeah, definitely. And then, I mean, when you're working with high level athletes, high school, college athletes, even professional, we work with here. So when you're working with those athletes, they're used to training, they're used to being in a gym setting prior to injury or prior to, an exacerbation or anything like that of an old injury. They were probably training as far as weight training, resistance training, anywhere from, 3, 6 days a week, depending where they're at in season, off season, depending, what they're following. So they're used to being in that environment. So an injury, sometimes maybe their first injury, it takes them down a little bit. And, it can be tough mentally too. So keeping them, through their injury and their rehab process, keeping them in a familiar environment for some high school athletes, especially, they're still able to, they can come do their rehab with us while maybe their friends or teammates are still doing their training and things like that. So they can still be around that. And I think that helps athletes mentally to be able to kind of push through that process and overcome those tough mental gaps as well. But from the physical side of things, yeah, I mean, it's, it's kind of bridging that gap. What we do is obviously in the acute phase, if it's a post-op or whatever, that's not going to look too much different depending what we're doing. But in those later stages or those higher levels of rehab, we're certainly bridging that gap. We're bringing in our strength and conditioning principles and kind of bridging that gap between rehab and then getting them back to working with just their strength coaches or coaches at school and things like that, depending where they're at. So we're kind of bridging that gap. I'm sure you've heard, performance physical therapy and things like that too. So that's the biggest thing as far as those later stages. A lot of times when athletes go to, your traditional outpatient clinics and things like that, when they get to the later stages, and that's what I was finding before I started Strive, is you're not able to load them enough resistance wise, and you're not able to have them actually go through those movement patterns that you as the clinician and coaches need to be able to see as far as if they are training here with their performance coaches here and then us as the clinician, we can discuss hey, let's work on, this. We need to change this posturing a little bit. We need to focus on these muscle groups a little bit more. So we can kind of not only load them in their rehab and take them through those processes, but we can also communicate with their coaches um, as they're right on site too, which is key as we're bridging that back to full return to play and full return to training as well.
Awesome. Thank you.
And you seem really busy all the time. So this leads into my next question. Do you have like a favorite productivity hack for young professionals, or what do you usually do? Do you have a hack? Do you
Yeah, I mean, I don't know that there's really a hack for that. You just kind of you gotta put in the time and work. Gotta stay organized. I would say is the biggest thing. Have things organized to where what's coming next. You know what your day looks like. You know what your week looks like. You know what you need to get done and that kind of thing. So not really a hack, just kind of time management, which you guys I'm sure are learning in grad school or have learned hopefully. But that grad school kind of prepares you to an extent. But sometimes it's late nights, early mornings, depending what the patient needs, what the athlete needs, things like that. But it's not always grind all the time either. You do get those times when you have some time, or like this past weekend, I had some time where I was able to go see some athletes where I had athletes on both teams playing up in Pennsylvania, so I got to go to their game and see them kind of face off against each other after we worked with athletes from both teams over the summer. So it's not all work all the time. You get to see these athletes, you help them get back, and then you get to see them back on the field and playing the sport that they love. So definitely rewarding from that side of things as well.
Yeah, for sure. We see you following your athletes all the time. That's really cool to see. So we know you treat a lot of athletes, obviously. So do you think you've gained the most like knowledge about athletes specifically through your personal experiences, or maybe about your certifications or grad school? Could you talk a little bit about how you've gained your knowledge?
Yeah, for sure. So, I mean, experience is key. I'm sure you guys have heard, as you're going through school and things like that, your clinical experience and your clinical knowledge from years treating and working with these athletes or whatever population you're working with, not just athletes, but anything in physical therapy, experience is so important. So, as you're learning, and especially as you graduate and get out there, you really have to get in a clinic where you kind of have someone that's more experienced, that's been treating whatever population you want to treat for several years, that can kind of give you kind of that mentorship as you start to grow and develop your own pathway and your own career too. So personally, a lot of my experience came, I had a great final clinical rotation when I was finishing up grad school. So I did a 16-week rotation out in Phoenix, Arizona, out in kind of the Gilbert Mesa area. So it was outpatient. It was majority athletes, but a mix as well. We did have some geriatric and things like that, but majority athletes and active adults. So we had 5 great therapists. It was a very busy clinic, and kind of learned a lot out there, working primarily with soccer athletes. As out in Phoenix, they can play soccer year round because the weather is pretty much great year round. So they play a ton of soccer out there. So learned a lot from those experienced clinicians and kind of brought a lot of that into my practice today. That's kind of where I learned the dry needling skills, and kind of saw the usefulness of dry needling, which sparked my interest to later pursue that and get certified in dry needling, and using that with my athletes as well. So I would say your clinical experiences are very, very important in your growth. And then once you get out there, just gaining as much experience as you can from experienced clinicians that are treating that population that you want to learn more about, kind of get a mentor that'll take you under their wing, and you can learn and grow, and then you kind of develop your own way as well.
Awesome. Yeah, we've heard you're the best dry needler on the shore. So nice you
Appreciate
talk
it.
about that. Yeah.
Yes, sir. Next question I have. What's a common challenge that you say you'd face on a day-to-day basis, and how do you work to attack that challenge every day?
Sure. I mean, I'd say, pick a common one you guys are going to be familiar with is time management for the athletes, right? We're working with college athletes majority of the time. you know, they're college athletes. They love playing, they love practicing, they love their sport, but they're still college students, and they've got classes, they've got team lists, they've got team meetings, they've got practice. So we are super close to Salisbury University campus as well as University of Maryland Eastern Shore. We see a lot of athletes from both. But still, I mean, they have to leave campus. They have to kind of make time. So kind of trying to time manage, each athlete's schedule and be able to, get them in for their treatment time, and not, rush through something or do this, miss out on certain things. But, athletes kind of got to be, we have to be flexible with the athletes. They kind of have quizzes, have tests popping up that, maybe they didn't study enough for, maybe they, had a busy weekend where they didn't get as much studying done as they wanted to, and they need to catch up. So we have to be flexible for, them to be like, hey, I need to move my appointment to this time, or can we, push it to a different day and things like that. So that's one of the common challenges is, you wake up in the morning, you look at the schedule or look at it the night before, and, it's going to be fluid and kind of moving throughout the day. And you kind of just got to work with these athletes so that they can, obviously they need to attend practices and games or treatments with their athletic trainers, or lifts with the strength coach and team meetings, team events, things like that, on top of their physical therapy treatment with us. So we just kind of be fluid and work with them and just kind of move things around as we need to and adapt as we go.
Yeah, it seems like I follow you on social media and stuff. It seems like you're working late nights, but I guess like that's what you have to do when you're trying to treat the athlete. And if that works in their time frame and it works with you, you got to do what you got to do to make it work. So having that
Yeah.
flexibility seems really important.
Oh yeah, for sure. And a lot of times they want to come, or it's best for them to come. If they are practicing or have games and things like that, we're gonna get them in after practice. Especially, obviously, our high school athletes are a little bit more limited in coming during the day because they're in school, and then they go right to practice. So those evening times, sometimes you just got to stay late, get the athletes in, get them treatment. Sometimes that means weekends. Sometimes, I've taken evals as late as 9:30, 10 p.m. before, just to get these athletes in, get them evaluated, and get them the treatment they need to keep them rolling.
Yeah, my next question has to do with like just we kind of touched a little bit, but just like advice for students, maybe going to their clinicals, or actually once we graduate, like going into our first job. Like, what do you have any advice on what we should be looking for, or like maybe something about like you talked about the importance of experience through from good clinicians and learning from them. Do you have any like specific thing that you would suggest looking for through clinicals or like your first hire?
Yeah, great question. I mean, some students, as you're going and you're learning different things, you may know what setting or what specialty you want to kind of go towards, but other students may not. I mean, I know, students in my class and things like that, kind of as we were getting even towards the end into our last rotation, not everybody knew what setting they wanted to settle in, and that's fine. So as you're going through clinicals, get a variety of experiences. Even when I'm talking with students that are in undergrad and considering PT, or we get a lot of interns from Salisbury's exercise science program. I tell them all the time, I'm like, get observation hours as much as you can in different settings, right? Obviously, if they're here, they're talking to me, they're seeing a sports specific setting, but as we know, PT is so much more than that, and there's so many more settings. So just kind of get experience. Some things you're going to be like, yeah, that's okay. Some things yeah, I really like that. Some things you're going to be like, nah, that was cool, but not really for me. So get experience in different things, and then as you move on in your career, in your graduate career, towards the end, you kind of start getting closer and try to get those last rotations in the settings that you think you might be most interested in, and then try to pick the sites that are going to be relevant to what you're interested in, what you want to see. For some people, that might be general outpatient. You may not have a specialty that you want to do, but you want to be in an outpatient clinic, and that's fine. Try to find and research about those clinics. If you can find out what clinicians are there, if, depending what area you're in, and try to find a clinic that is going to give you a variety of experiences. You don't want to see the same diagnosis over and over and over, especially as you're trying to learn. But you also want a good clinician who kind of knows what they're doing, is up to date on modern practices and treatments, and and you can kind of learn things, and you're going to take those, whether you realize it at the time or not, you're going to take those things and use them in your own practice. I know, thinking back to all my rotations, there was bits and pieces from each clinician that I was with and each setting I was in that, you grab part of this from this clinician and something this other clinician did during an eval. And then as you start practicing, you're like, hey, I realized that, I pulled that from here, and I got this from this clinic, and I learned, this Therex or whatever from a different clinic. And you're going to start molding your own practice around the experiences that you have. So being in those clinics that, those better clinics, the more up-to-date clinics, with clinicians that are experienced and know what they're doing, even if that's just general outpatient or an inpatient or whatever it may be that you're interested in, is going to be key, because that's going to pull through to how you practice.
Thank you.
So for sports medicine with you, I know you said you went to Lebanon Valley, right? 3-3. Did you know when you were coming in, did you know you were going to work with athletes eventually and kind of tailored everything towards that? Or
So I'll say short answer is no.
like, what's your athletic background? Do you have an athletic background that we need to know about? Or
Sure, yeah. So I mean, I grew up playing sports from the age of 4, all the way up. I played little league and multiple different sports. I played sports all through high school. My primary sport in high school was ice hockey, which, being here on the shore, there's not much ice hockey, except for I do work with Salisbury University's ice hockey team, and go to all their home games and take care of those guys. So, but that was my primary sport. And then going to the 3-3, I kind of decided I was planning to play hockey as part of the reason I chose LVC. But when I got to campus, kind of a last minute decision, just decided to say, you know what, school's kind of more important, and I don't want to devote that time to hockey right now. So I did play 2 years at the NCAA level. I played 2 years of golf in college. So I played a variety of sports, but kind of going off that topic, piggybacking on that, one of the biggest things when I talk to students and when I have, UMES students coming through or undergrad students, being in the sports medicine field and being in, working with these athletes, you've got to know not only the different sports that you're working with, but you've got to know those sports, you've got to know the positions, and you've got to know the differences in those positions. And that's going to all depend, change how your treatment is going to look, possibly, at the end. But you've got to know the sport, you've got to know the positions, you've got to, if you have the opportunity, pick up a stick, pick up whatever ball that that sport is. If you have a rugby player, pick up a rugby ball and learn, hey, what do they actually have to do? What is this sport? What different positions are there? I mean, there's 15 positions and 15 players on the field in rugby, for 15s or 7, and obviously for 7s, but they all do different things. They're all going to require different body mechanics, different movement patterns, things like that. So it's not enough for you to somebody to walk through the door and say, yeah, I play lacrosse. It's like, okay, that's great, but what position? You've got to know those positions and kind of know those questions to ask. So that's one of the biggest things if you start to specialize in sports is learn those positions, or learn the sport, learn the positions, and you've got to kind of know what movement patterns that's going to entail and for that position, because rehabbing a defensive player in lacrosse is going to look a lot different than the rehab and movement patterns of an attacker or things like that. So you're not going to know every sport, but you may get an athlete walk through the door that plays a new sport and take some time, look it up, learn how to play. If you have the chance, kind of like I said, learn how to play, learn how to at least what movement patterns they require and that kind of thing. So that's one of the keys I tell all the students that come through. You got to know the sports, you got to know, and you got to know the positions and those movement patterns.
cool. Yeah, that's a really good point. I was just thinking, I was like, yeah, I grew up an athlete and I want to work with athletes, but if a rugby player were to walk in the door, I may have no idea because I don't know much about rugby at all. So that was a really good point. Thank you.
Yeah, so my next question is, obviously we know you're a physical therapist, but you're also a business owner. I wasn't sure if you could talk a little bit about how you became a business owner, how you got the idea, and then kind of like how you got your foundational business owner skills, like if you had a mentor or something like that.
Yeah, so it's a great question. So going from a treating clinician to a business owner side of things is a big switch. So I mean, on the physical therapy side of things and private practice side of things, there's three different kind of ways you can go as far as opening your own business. So for Strive, we're primarily an in-network with insurances, right? So we're in network with some of the major insurances, not every insurance. Some insurances we tried to get a network with, but that maybe they weren't contracting new providers in our area, things like that. But like your Blue Cross Blue Shield, we're in network with, and some of your Maryland insurances and things like that. So we're primarily in network, and there's also, you know, clinics out there that I'm sure you've heard of that are going to be primarily out of network or just strictly cash based as well. But starting out, I mean, we kind of touched on it a little bit. I was working for, you know, a national chain outpatient clinics, and, you know, being here in Salisbury was kind of getting to work with some of the Salisbury athletes that just happened to, you know, go to that clinic. And I was the only one there that, you know, was kind of starting to specialize in sports and things like that. So I started to see more and more of those athletes and in that clinic. And then, like, kind of we talked about before, touched on a little bit, kind of start to get frustrated with you don't have enough time, you know, whether it be you're in a clinic where they're scheduling every 15 minutes or every half an hour, or you know, multiple patients, double, triple booking. You know, you may have an athlete come in and 30 minutes later you have an eval to start. It's like, okay, well, that athlete's not going to get a 30-minute treatment session, or if they do, that's not good, right? So kind of gotten frustrated there, but also the space. I mean, you go to, you know, most outpatient clinics, you know, you got 8, 10 tables, maybe more, you know, plinth tables, you've got some ankle weights, some dumbbells and TheraBands and a bike, a treadmill and an arm bike, right? So got a little bit of space, but I mean, what can you do with, you know, that little bit of space as far as the end stage of rehab, right? Early on, sure, you can do some stuff and give them some treatment, but later on, I mean, I know speaking for Strive, you know, once we opened here, so all our facilities have indoor turf. We have full weight rooms, and we're located right like inside the gym area. So, for example, the location I'm at now, we have about 20 yards of indoor turf with we have the capability to pull nets all the way around. So when I work with lacrosse athletes, we have a full size lacrosse goal that we'll set up, and we'll have them with their lacrosse stick in their hand going through, you know, dodging movement patterns into shooting if that's relevant to them, and, you know, have them actually going through their sport. We're working with a football athlete, you know, we have different blocking pads and things like that, and turf area where they can do agility work, they can do cone drills, we can laser time them here for their 5-10-5 and things like that to assess those kind of things, where you're not going to have that at traditional outpatient clinic. You just don't have the time or the space, and most of the time you don't have the resources either. So that's kind of why I started, you know, building out Strive to specifically for athletes, is because, you know, trying to work with these athletes in that kind of setting, you can't give them the best treatment that, you know, you could give them when you have the space, when you have the time where you can, you know, not schedule them, you know, so close together, so you can actually, you know, evaluate and assess their movement patterns and modify things and change things and tweak things and that kind of stuff. Not to mention actually assessing them and testing them, which is a big thing that's missed too, is, you know, looking at athletes going back to sport, you have to, you know, get them out there on the turf or, you know, whatever it may be to test and assess and use your clinical knowledge to, all right, how's that movement pattern look? How does that relate to maybe comparing it side to side? Or how does that relate to, you know, what they actually are going to have to do on the field, in addition to, you know, dynamometry testing and things like that. You know, you need to watch them go through their movement patterns for sport. That way you're not just like, okay, your quad looks strong, 5 out of 5. You know, it's been enough time, so good luck. We'll hope you're good. That's just not good enough when you're treating high level athletes. You know, you got to be assessing, and you've got to be, testing, retesting with objective data, and then also, like I said, watching their movement patterns on what are they going to have to do back on the field.
Sounds like all your PT is definitely functional. So that's definitely good to hear, and definitely something we're learning, and definitely going to apply to our practice when we get out in the working world.
Next question I have, what's a common like myth or misconception about your job or physical therapy in general? If you have any off the top of your head right now.
Yeah, that's a good question. I guess the one that comes to mind, and I'm sure you guys have heard this, maybe you haven't, but um, when people, the general community that aren't, in grad school or aren't treating or aren't healthcare providers, um, you know, the biggest thing to realize is physical therapy is not a thing that you do, right? You don't do physical therapy. You go to physical therapy to meet with a physical therapist who hopefully is a specialist in your specific area of need, right? So if you have a neurological deficit, you want to meet with a physical therapist to be evaluated and develop a treatment plan of a physical therapist that's you know skilled and experienced in neurological. Same with if you have a child that has some sort of need for evaluation with a physical therapist, right? So physical therapy is not a thing. You don't do physical therapy, right? You go to a physical therapist to be evaluated, to discuss what's going on, and work together with your physical therapist to develop that plan and that plan of care, that plan of action to to get you back to where you want to be. So physical therapy is not something that you do, not something that you do. You don't do physical therapy, with another healthcare professional or coach or whatever. Physical therapist is somebody that you meet with, and hey, it's a healthcare professional that's gonna meet with you and evaluate whatever it may be that's going on, whether it's a sports injury or whatever, and develop the best plan of care for you, and then work with you throughout that plan of care to get you back to where you need to be.
Thank you. Yeah, that's a good answer to that. We had a interprofessional event a couple of weeks ago, and I'm not going to say the profession, but there was some students that were like, "So what are you going to do after you graduate? Like, what is physical therapy? Like, how are you going to work as a physical therapist?" And it kind of just like drove me crazy a little bit inside, and I had to explain to them. But yeah, that's definitely a common misconception about physical therapy.
So we're running out of time. There's only 8 minutes left. Do you have any questions for us that you might ask as students? Yeah, anything about lead trauma, anything in general?
Yeah, I mean, obviously I followed you guys page for a while now. I think it's great, which the content you're putting out. I know we talked about it before, so hopefully we'll be able to collaborate on something soon with league trauma. But yeah, I mean, how has it been for you guys? I guess since COVID and past COVID. I mean, are you back kind of? Are you still kind of hybrid learning as far as online, or are you mostly your traditional lectures and stuff in class, or is it still kind of a hybrid? How's that been going for you?
We're
Yes.
we're all physical. We're are you go
No,
ahead, Josh.
you got it, bro.
Yeah, we're all physical now. Not really any hybrid learning whatsoever. Everything's in person. Um, I would assume that's exactly how PT school was for you. I know it was different for some other people that got hit during COVID. We were both in undergrad, but end of sophomore year of undergrad when COVID first like became a thing. And I know like for the remainder of our time, we both went to McDaniel College too for undergrad.
Okay.
So I guess for the remainder of our time there, it was kind of that hybrid feel. But like now we're back into full swing of things, and I'm glad that we are actually in person and touching each other because that's, I mean, what we have to do as physical therapists.
Yeah, absolutely. It was brutal having to learn through the computer like this. And it was hard to learn like this, hard to interact with other people, and just hard to like. I mean, I feel like I learned so much from just like talking to people like you, talking to like Josh. Like, just like so much easier for me to learn through conversations with intelligent individuals as opposed to just sitting on a computer all day and listen to a lecture and then taking a test online. not fun. But yeah, we're all back like Josh said, and we're very grateful for that.
Yeah, I completely agree with you. I mean, I couldn't imagine having, students that went through or were in PT school, when everything was kind of virtual and that kind of thing. I mean, I personally, I don't think that would have worked for me. I'm sure they powered through and got it done, but good. I'm glad to hear. I guess last question is where do you guys see, a league trauma going in the future, and kind of what's your goal with that?
So our goal right now is just to try to get as much content out as possible and try to engage as many much audience as possible. Long term, probably we're thinking about opening up our own place under the League Trauma name for physical therapy. That's longer down the line. We got a lot more to learn about the business side, and so that's what we're trying to talk to as many business owners in the physical therapy field as possible, and just to pick their brain, learn about it. But yeah, just to build that social media following right now, and just trying to not only teach people about the human body and the injuries that are going on, but also just learning for ourselves and learning from these high level athletes and how the mechanism of injury is occurring and why it's occurring and maybe what their rehab process looks like.
Yeah, I'd say early on it started. We just got into PT school and we were taking anatomy. So it's like we were starting to learn all about the body, and then we were seeing these injuries, kind of breaking down the mechanism, but we didn't really know much about like the rehab side of things. So we're hopefully we're trying to transition into that phase where we can start to talk about like maybe the rehab side of the injury instead of just the injury. So once we graduate and become practicing clinicians, hopefully keep the league trauma brand going and actually be able to like talk to somebody about, okay, yeah, this injury happened, they tore their ACL, but what is it going to look like for them for the next several months to a year until they get back to return to play, instead of just, oh, this is they planted, they twisted, it popped, and that was it. Like we want to take it a lot further, but from us starting it as just first year PT students, taking on that load of trying to create content as well as trying to learn as much in the classroom, it's been tough, but we definitely see it growing, and we hope to get others involved as much as possible to expand our team and just deliver content to the people out there. We know everybody's spending a lot of time on their phone every day. I mean, we do it, like it happens. Instagram, TikTok, like it's just what happens in today's day and age. So we want to hope to reach as many people as possible and continue to grow League Trauma.
Hey, you guys are doing great. I love the content. Definitely looking forward to more of it.
We
Thank
appreciate
you.
it.
Thank you. We thank you. We're very thankful that you took the time out of your day to talk to us. We learned a ton of information from you, and like you said, we'll continue to be in touch about a collab and stuff. And yeah, just thank you very much for taking the time out of your day.
Yeah, it's my pleasure. You guys are welcome. Glad to be here. Glad you guys reached out. I know we didn't touch on kind of the specifics of business that much, but if you guys have questions and want to talk more about that, we certainly can kind of get into that a little bit more, offline and things like that if you guys have questions. But it was great to be here.
Thank you very much.
Sorry, thank you, Travis.
I will see you guys.
Yeah.
We'll see you.